If you hate your job, you want to pursue a long-term career with actual livable wages that are comfortable for you and your family, but you're just not in the right circumstance to go back to school for a degree, and you've always been interested in healthcare, I've got you. This is the video for you. Today's video, we're going to be diving into 8 different health careers with minimum to no experience. I'm talking about starting a new career in as short as a month, okay? We have quite a few of these careers that don't require any patient interaction, which is amazing for us introverts, or one remote job that you can do from home in your pajamas. Yes, and it's stable and it's pretty good money. So if you're interested in any of this, stay tuned.
Sterile processing technician.
Starting off strong, sterile processing technician, or some people call it central sterile supply technician. Long title, I know. But this is number 1 for me for hidden careers because absolutely no one really knows about this career. And it's really, really cool. You literally can be part of the underground OR team. The technician decontaminates the surgery tools from the OR. There is a special type of way you have to decontaminate it so it can be used for the next surgery. So that's why it requires a certification. And there's 2 different ways to go about getting certified. You can go the self-taught route, where you just go to a hospital and you ask to shadow, because before you take the state exam, you have to meet a number of clinical hours. So you can do like an unpaid internship or paid internship, whatever is going on in your area. Or you can just complete a program within, 4 months or however long. I think max is like 4 months. For me, it took 1 month. I went online, a self-paced program, Penn Foster. Yes, I have done this career before, and I stayed in the field for about a year, and I can make a whole separate video about that later on. If you guys want, just let me know in the comments. But yeah, you can either learn yourself from the books and a few clinical hours, or you can, enroll in a program, waste a bunch of money. I think I would have done the self-paced route, but I mean, we can talk about that later. It depends. It depends on your circumstance. But yeah, they make, as you can see, pretty good money. What does it say here? 40 to 55K. I would say keep in mind, and this goes for a bunch of careers in this video, to take that number with a grain of salt. Not that it will ever be lower, but actually higher, like much higher, because after a year experience, you can pick up travel assignments or contracts and you get paid way more. I'm talking about like 2K a week type stuff. It's really, really cool. But yeah, that's sterile processing technician. I love the career. You do have to have, a bit of a strong stomach to endure the strong scent of blood on the metal tools. It's pretty pungent, even through 2 masks. Obviously, you do wear a full gown of PPE. But yeah, it's pretty cool. Let's move on.
Surgical technologist.
So to become a surgical technologist, you only need a 1-year certificate. This is, out of everything in the video, this will be the longest certificate that's needed. Or you can do a 2-year associate's degree. Most people just go for the certificate because, of course, why not? They make an average of 48 to 66K a year. What they do is they set up the OR. for surgery, and then they stand side by side with the surgeons and pass the surgery tools that are asked by the surgeon. I've heard as a sterile processing tech, a lot of them eventually transfer into surgical tech because you worked with the tools, you know all the names of the tools. It's a really, really good segue. It just makes sense. And obviously you make more money, but you have to have thick skin. Obviously, it's not just about passing tools. You have an open body right on the table in front of you. You have to be able to stomach that. And also working with surgeons, I've heard is pretty intense. They do have a reputation of being mean, but again, you're dealing with life or death, so you can't really make mistakes. If a surgeon is asking you for something, you have to be able to identify and quickly give them that tool. I mean, it's really hardcore. I've known a lot of people that have transferred into being a surgical tech, but then went back to being sterile processing technicians because they said they couldn't take the pressure of being in the OR room and having the surgeon, yell at them or whatever. So it's really something that you should probably shadow before you fully commit to it. But it is very, very cool.
PCA.
Okay, so moving on to PCA, patient care assistant. Obviously, this is way more known than the other two careers. But what I didn't know is that not only is the certification for this free, the state pays for it, but it's only a couple days and it's all online. So you just have to watch a few videos online and take some quizzes. It is a lot of videos, not a few. Just to let you know, it's a lot of repetitiveness, a lot of videos. But hey, for a certificate, that's fine and it's free. That's great. The pay is 32 to 40K a year, again, average. And most of you know, as a PCA, similar to a CNA, pretty much they're interchangeable. You assist patients or clients with daily living, such as bathing, changing, feeding, even, if you're doing at-home services, you'll be doing like cleaning as well. But if you're in the hospital, you're obviously going to get paid a lot more than with an agency, and mostly just bedside care. And keep in mind, you can become a CNA as well, which I think you should definitely do that instead of PCA long term, just because it pays more money and you have more opportunities. You can pick up shifts and travel as a CNA as well. And a lot of people don't even think about this, but you can be a CNA or PCA in the maternity unit of a hospital. That means that you're going to be caring for the babies. Imagine just washing babies up for a living. I mean, how adorable is that? So definitely something to look into. A lot of companies will pay for your CNA training, and CNA training is only a month. I am a former CNA as well. So it's something that you really have to have love for, patience for. You can't really think about this job, well, any job in healthcare, as like a career, but you have to really like working with people, because this is a very intimate job to bathe someone that's in need. Like, these are such things that we take for granted, and to make someone uncomfortable or awkward because you don't like your job, it's not a good look. It's really sad. I know when I had surgery and I couldn't walk and I needed care and assistance, the nurses, the aides, they really made a difference in my recovery. I mean, they made me feel good about myself. They didn't it wasn't uncomfortable in any way. They were gentle, and I really felt taken care of. I had a peace of mind because I knew that I had good staff to look after me. So don't just take this job if, you're just trying to like get your foot in the door. There's other careers out there for that. But this one, you really do have to have a love for people. You have to have a tenderness and care. So I just wanted to add that.
Patient transporter.
So patient transports are one of those careers where you don't need a certificate at all. You literally are just transporting patients from one department to another. They make around 30 to 38K a year. That's roughly $14 to $18 an hour. These are one of the lower level careers are going to be mentioned in the video, the lowest paying job. But again, it's all about getting your foot in the door. So, maybe you can be a patient transport when you're in school as a surgical tech. You're already building that rapport as an employee. Make sure you're clocking in on time. You get, you make a good impression so that you can be referred for a position that you're hoping to pursue in the future with that hospital. So again, it's livable. It's not the best, but it's again a great way to get your foot into the door.
Dental lab technician.
Okay, so for dental lab technicians, this is another unique career. Certification can take as short as 8 months or 18 months from what I hear. You can also get a 2-year associate degree. Of course, most people will go for the certificate, which is absolutely fine and acceptable. The pay is between 40 to 55K a year. And what dental lab techs do is they create custom the crowns, the dentures, the veneers, basically any type of orthodontic device. That's what the dental lab techs do, which is really cool. So it's like, again, you have to be precise because any small mistake can affect someone's bite or smile or comfort level. So this is one of those delicate jobs yet again, but this is no patient interaction for those who are interested in that. So it's a great job that's kind of like laid back a little bit. It's usually in like a large lab facility, sometimes even in dental offices.
Phlebotomist technician.
Okay, you guys seen what kind of technician this is? Every time I try to say this word, I end up sounding so silly. I'm not even going to attempt, but you guys, I'm sure, are familiar with this role. They take your blood, fun. Again, you have to have the stomach for this job. Not everyone does, obviously, but certification for this is very, very short. The training is basically a 4 to 12 week program. So it can be as short as 1 to 2 months, which is amazing. And they make about 36 to 45K a year. These, I think, these technicians also can pick up shifts and travel. So there's a lot of variety with this role in terms of settings.
Neurodiagnostic technician.
All right, we're nearing an end. We have a neurodiagnostic technologist. They're mostly called EEG or sleep techs. So this career only requires a 1-year program and they make 50 to 70K a year. They monitor the electrical activity of brain and nervous systems when they attach sensors to a patient's scalp to monitor brain waves and may also monitor nerve function during surgery to keep patients safe. These studies help diagnose epilepsy, seizures, sleep disorders, and other neurological issues. Some neurodiagnostic techs also work overnight in sleep labs, which is what I'm most familiar with. It's a career that combines patient care with advanced technology, and it's a great option for those interested in neuroscience without going to medical school. So this is a really cool career as well. I just love healthcare. I keep saying everything is cool because it is. Like, that's wow. To be able to like get into neuroscience without having to go to med school. Yeah, I say that's pretty awesome. This is a career that does have patient interaction, but it's very minimal. Like, the patient is not even awake for majority of the time. It's really just setting them up, and then discharging them is when you're interacting. But the in-between period, you're not interacting with anything. You're only monitoring their brain pattern. So yeah, that's something to keep in mind.
Medical coder.
All right, this is it. This is the job that if you're waiting to hear about the work from home opportunity, this is the career for you, medical coding. So medical coding, it really varies in terms of the qualifications. You can qualify for a certificate in as short as 4 months or 12 months. So it's 4 to 12 months. It varies because you can either go the self-taught route, you teach yourself coding through buying the books and everything, or you can go to a program. Most of them don't take 12 months though. I've seen some max 8 months, but that's what it said when I did my research, that some programs take 12 months, but I think that's fair. I think it's more common for it to take 4 to 8 months. They make about 46 to 60K a year, which is awesome. Medical coders are the translators for the healthcare system. Every time a patient visits a doctor, has a test, or undergoes a procedure, coders review the medical records and assign standardized codes to every diagnosis and treatment. So these codes are essential for insurance, billing, government records, and hospital data. So it's basically a little language for the billing department and everything that just mentioned. I have been studying for it. It's more just like time consuming to memorize like all the codes and stuff, but once you get the hang of it, it's actually pretty fun and cool. And I can make a separate video about that, since I'm currently in the process of pursuing a medical coding certificate. We can, work together. Let me know if you want it to be a series or something. My study process, because I am self-taught, I didn't go through a program, just because I want to do it fast as possible. There you have it, your 8 careers as promised. Let me know if any of these careers sounded interesting, or if anything surprised you at all in this video in the comments below. Would love to hear from you all. Also, before I go, on October 8th, I will be creating a work from home job series where I post 1 video daily for 7 days as a way to kickstart my channel. I'll be sharing not only remote career paths, but live job postings for entry-level jobs for those who need a change right now and can't wait. If you like what you see so far, be sure to subscribe and click that bell so you stay notified when I post next.